Today's module is brought to you by winter, the season that makes you say, why do we live here again? So here we go, the urinary system. This module will focus primarily on the structure. From a macroscopic perspective, a gross viewpoint, the urinary system is actually one of the simplest body systems, consisting of only four major portions: the kidneys, which make urine, the ureters, which carry urine from the kidneys down into the urinary bladder, which is basically just a storage organ, and then the urethra, which is the tube that carries urine out of the body. The only significant differences between the male and female anatomy relative to the urinary system is really the urethra. As you can see on the right side, the female urinary bladder empties through a very short urethra, whereas the penis extends the urethra. This helps us to understand clinically at least part of the story behind the incidence of urinary tract infections, which is nearly 50 times more common in women than it is in men. The urinary system's primary job is to get rid of these nitrogenous wastes: ammonia, urea, uric acid, and creatinine. These are all actually downstream metabolites of protein synthesis. And if you were to go into sudden and complete renal failure, you would get sick within just a few days and you wouldn't survive the week. These toxins within the blood are so deadly, and the urinary system has to get them out. Functions of the urinary system fall into these major categories: filtering of the blood to produce urine. We might think of it as dirty blood. Waste-laden blood enters the kidneys through the renal arteries. The kidneys help to filter out those wastes like urea and creatinine that we were just talking about, and they flow out of the body and into the fluid, the waste fluid we know of as urine. The kidney has to save nutrients and electrolytes, though, that are also in that blood, separating good things which stay in the blood and bad things which flow into the urine. So the so-called clean blood then returns to the body through the renal veins and then into the inferior vena cava. The kidneys also serve regulatory functions in terms of helping to control our blood volume and pressure by making more or less urine at any given moment. The kidneys also regulate concentration of blood solutes, these so-called electrolytes like sodium, chloride, potassium, calcium, and phosphate. The kidneys also serve a very important role in regulating the pH of our body, because the kidneys can regulate how much hydrogen ions are secreted into the urine. So if we're acidic, the urine carries more hydrogen ions out of the body. If we're alkaline, the urine will contain less hydrogen ions as a way of keeping those in the blood. The kidneys also regulate blood cell synthesis, as we'll see in just a moment on a subsequent slide. The kidneys secrete a hormone called erythropoietin. And the last, but certainly not the least important function of the kidneys is synthesis of vitamin D, and I have another slide coming up that goes into detail on that. So first of all, this process of erythropoiesis, the kidneys stimulate red blood cell formation by releasing a hormone called erythropoietin. Erythropoietin flows through the blood to stimulate the bone marrow to upregulate red blood cell formation. And so we can see anytime we have low oxygen, so we start a new exercise routine, or we go into the mountains, or for any reason maybe we're anemic, our low oxygen levels will stimulate the kidneys to make more red blood cells to make up for that deficiency. The kidneys are also important in developing the most active form of vitamin D, what we call calcitriol. So this process actually starts with sunlight. You might know that vitamin D is sometimes called the sunlight vitamin or sunshine vitamin. The way that it works is ultraviolet B radiation from the sun interacts with cholesterol within our skin to make a pre-vitamin, which then is converted into vitamin D3 cholecalciferol. Flowing through the bloodstream, cholecalciferol is hydroxylated in the liver to a more active form called calcidiol. And finally, here's where the kidneys come in. The kidneys convert calcidiol into the most active form of vitamin D, calcitriol. And we can see it's important in absorbing calcium, in keeping our bones healthy, in keeping our immune cells active, in preventing cancer. And there has been some recent research to suggest that vitamin D can be an effective treatment for certain forms of depression and chronic pain and fatigue, and that regular supplementation of vitamin D can help to reduce your risk of developing multiple sclerosis. Here's a gross anatomical perspective of the urinary system. And again, we can see the kidneys, posterior, they're called retroperitoneal. They're sort of behind that blue membrane you can see there at the bottom image, along with the pancreas, jammed right up against the spine, very posterior in the abdominal cavity. The ureters descending down into the pelvic cavity. You can see just how very low the urinary bladder is, very near to the pelvis, and then the urethra exiting below. I think the most important things to take away from this picture are the size of the renal arteries and veins. Look at that, big veins and arteries. And that's because nearly 20% of the blood at any given moment is flowing through your kidneys. Pound for pound, they probably get more blood than anybody. Here we see a sagittal section of the kidneys. And again, a large renal artery and large renal vein bringing blood into and out of the kidneys. We can see anatomically that the kidney has several different layers. On the very outside, there is a fibrous capsule called the renal capsule. That's not significantly important, certainly not physiologically important, but it does seal in the organ. The outermost layer of the kidney, just deep to that capsule, is the cortex, the renal cortex. And then the deepest layer of the kidney is the renal medulla right here. And we can see the renal medulla is where the renal pyramids are and where the renal columns fill in the space between those pyramids. It's a bit confusing because the renal columns join more superficially to become the cortex. So technically the columns belong to both layers, cortex and medulla. The renal pyramids are really where most of the action is physiologically, as we'll find out in upcoming modules. This is where urine concentration is occurring, and the renal pyramids are just chock full of these tiny urine-making tubes called nephrons. Once the nephrons make urine, the urine drips out of the bottom of the pyramids through structures called the renal papilla, sort of these pointy bits fitting into the funnels below. In yellow, these tiny funnels are called the minor calyces, which converge to form major calyces, and then all of the calyces converge to form the renal pelvis, which narrows into the ureter. Here are the tiny urine makers, the nephrons. You have more than 1 million of these tiny structures in each kidney. And these nephrons fall into two categories: the cortical nephrons, which exist mostly in the outer layer. Here's the cortex. The juxtamedullary nephrons are buried a bit more deeply, and they're little hairpin tubes here. These little loops descend very deep down into the renal pyramids, the renal medulla, the layer. And we'll find out in upcoming modules that they serve a very important role in concentrating the medullary ECF. So as urine continues to flow through these tiny tubes. Eventually, it drips out of the bottom. Here's the collecting duct, and then the urine is emptying out of the renal pyramid through these papillary ducts, and again into the minor and then major calyces, and then the renal pelvis and the ureter. Zooming in a bit more, we see that each of these nephrons has two major divisions, the renal corpuscle and the renal tubule. The nephrons are the functional unit of the kidney, and by that we mean that you can't really get any smaller than a nephron and still produce urine. Zooming in even further, we see now the renal corpuscle is divided into a couple of sections as well. We see vasculature in red. Starting here with the afferent arteriole, blood will flow into this knot of capillaries called the glomerulus, and then blood will flow out this much smaller efferent arteriole. In the process, much of the liquid portion of the blood, the plasma, is actually squeezed through this knot of capillaries and captured by this capsule referred to as the glomerular capsule. That fluid is called filtrate, and it will then flow into the rest of the nephron, the renal tubule, and we'll talk about that in the next slide. The glomerular capsule, this outer layer here that looks something like a light bulb or an onion, is made up of two different layers, the parietal layer and the visceral layer. And as we see here, the parietal layer is the outermost layer. It's a layer of simple squamous epithelium that really makes a cup to capture the filtrate that's going to squeeze through this area right here. The inner visceral layer of the glomerular capsule is made up of special cells called podocytes, and they're going to make an additional screen to make sure that blood cells and large proteins within the plasma don't leak out. We want those substances to stay within the bloodstream and leave the glomerulus through the efferent arteriole. Here's another perspective of the renal corpuscle, and specifically we're looking now at those two layers of the glomerular capsule. Zooming in even more now, we can see that the glomerular podocytes, these pink cells, are interdigitating, right? Their little fingers are folding in once amongst the others as if you were holding hands with someone. And we can see that, zooming in even further, that the filtration membrane actually has three different layers. First of all, we have the endothelium of the capillary. The glomerular capillary is a super leaky capillary. You might remember they're called fenestrated capillaries, named for the tiny holes called fenestrae. There's a shared basement membrane shown right here in yellow. And then these purple globs are just a very zoomed in perspective of the interdigitating podocytes. Now, if we flip to this video for a quick second, we can really see what's happening. Maybe. In this video, we see the urine formation process right here, whereby clean blood is coming into the kidney through the renal artery. The kidney is separating wastes from nutrients, bad from good, so that the good things go back into the bloodstream through the renal vein, and the waste products flow down through the ureter and into the urinary bladder. If we zoom in just a bit more now, returning to this idea of the filtration membrane, we can see right here the glomerulus, the knot of capillaries, surrounded by the glomerular capsule. In this video, they refer to it by the old historical name Bowman's capsule and Bowman's space. Now we're calling it the glomerular capsular space and the glomerular capsule. These structures are surrounding the knot of capillaries, which is called the glomerulus. So if I push play here, we can see blood flowing into the glomerulus through the afferent arteriole, The yellow arrows represent filtration. Squeezing the plasma through the screen, we can help to keep blood cells and large proteins within the blood. They leave the glomerulus through the efferent arteriole. And the fluid is called filtrate. Here we see the filtration membrane we were just talking about in the PowerPoint, the endothelium, the shared basement membrane, and the podocytes. They make the filtration membrane that is a screen allowing for this process called filtration. The most important concept to really master right here is that filtration does not separate good things from bad things. It separates big things from small things. And so we see blood cells, red blood cells, white blood cells, platelets, large proteins like albumin. They're going to stay in the plasma. But these filtration fenestrae and filtration slits only allow the tiniest liquid things, water, electrolytes, glucose, amino acids, fatty acids, hormones, and then the 4 waste products we talked about earlier, urea, uric acid, ammonia, and creatinine. These are filtered out. So filtrate contains both nutrients and wastes, but it should never contain blood cells. Anytime we see blood cells in a urinalysis, we're assuming that it's a urinary tract infection, although it could be something leading all the way up to this level, like a glomerular nephritis. Okay, if we follow this video just for a quick second here, we can see the filtrate is now captured by the glomerular capsule and then flows into the rest of the nephron called the renal tubule. So flipping back to the PowerPoint, we'll see the rest of the nephron here in the form of the renal tubule. The proximal convoluted tubule is the first section right here, just downstream from the glomerular capsule. Filtrate flows here first, the proximal convoluted tubule. Remember, this just means the near end of the twisty-turny tiny tube. Now the filtrate, we change the name. We call it tubular fluid from now on. And this tubular fluid flows into the nephron loop of Henle. First down the descending limb, then up the ascending limb and into the distal convoluted tubule, the far end of the twisty-turny tube, and finally into the collecting ducts. Some people call them collecting tubules. You can see these little stumpy branches here actually represent the fact that many nephrons, maybe a dozen or 20 nephrons, will all share an individual collecting duct. And so some people say that the collecting duct is a part of the nephron, some say it isn't. I say that it is. As we'll find out in the next module, the collecting ducts are really important in forming urine in terms of concentrating urine and conserving water. And so because it's physiologically important, I say this is a part of the renal tubule. Just going back for a quick second here, we can see the afferent and efferent arteriole passing very near to the glomerular capsule. It's important to recognize that the distal convoluted tubule makes a crazy turn back so that it passes right next to the afferent arteriole. If we look back at this picture, we can see that again, looking right here. The distal convoluted tubule passes right next to the afferent arteriole. This is going to be important when we start to learn how the nephron regulates filtration. And this so-called juxtaglomerular apparatus is going to be part of the nephron's intrinsic ability to change the glomerular filtration rate. If you don't understand what I just said, don't worry. We'll get to that in the next module. That's going to be on urine formation and these 4 steps: filtration, reabsorption, secretion, and water conservation / urine concentration.